3, 2, 1.
3, 2, 1.
Clap it up.
Welcome, everyone, to the Nursing School
Start
Show. Christina is getting
Hi.
Instagram up and running. Hello, Instagram.
Sorry, Instagram.
Welcome, everyone. I am Matthew.
Christina.
She is Christina.
Nice to see you again.
Nice to see you guys again. We have a good topic tonight to discuss. Super fun one.
Oh, sorry, I was rushing a little bit. I fed the baby. Was trying to respond quickly to some students inside our membership community Facebook group. Really great questions came through tonight, so I'm super excited
great.
to help our members.
Awesome.
Really good questions actually.
All right, yeah.
Exciting.
Does it have anything to do with our topic tonight?
Mm-mm.
No. All right. Well, our topic tonight is the hardest thing about med-surg in nursing school.
And that requires drum roll.
Should I try this again?
Nursing school.
Oh, okay.
I don't know.
Nope.
That might be a little too much for the microphone.
All right. And I wanted to know, I posted in the comments, and I think, Christine, you
asked on Instagram. But here's the thing, sorry Instagram, I don't think I can go, I don't want to go back on Instagram. I don't think I can get to my stories and see what you guys posted in my stories without exiting the live.
All right.
So I don't want to push any buttons too much because, I don't want to mess anything up. I don't want to accidentally close out Instagram.
So before we dive in, that is the first question is, according to you, your opinions in nursing school, what do you find to be the hardest thing about med-surg?
Yeah, what's the hardest thing for you?
What is the hardest thing for you guys about med-surg? Go ahead. Hit us up. Let us know. We will discuss.
Yeah, we'll talk about it.
Yes.
I think that there's a lot. Cardiac, Alyssa. Yeah. So what's the hardest thing about med-surg?
What is the hardest thing
cardiac
about
is difficult.
med-surg?
Definitely the critical thinking stuff when you have to put it all together. Meds, good one. Yeah. Starting med-surg next Thursday.
Okay, here's another question then. Who is currently in med-surg?
Good question.
And who has not taken med-surg? And who has?
Hi, Alan.
Do you ever get out of med-surg? Is that a thing?
I mean, med-surg is really med-surg is what's the actual definition of med-surg? Now, I mean, there's got to be an actual definition. Does anybody know? Anybody know the actual definition of med-surg? It's medical surgical nursing, which is basically everything.
I'm in med-surg now.
I mean,
presently struggling through. I have friends in med-surg, and there are so many tiers and so many, and many are failing. Is it truly the hardest class in the program?
So many tiers and many are failing. So you have friends in med-surg, Michael. You're actually not in med-surg right now.
Not yet, huh?
Hi, Annie. Yeah, some of the disease processes,
Studying with massive amounts of info.
Balanced.
It's great.
On Instagram. See, I can read that. First year nursing student. Hello, welcome. So does that mean fundamentals? Okay, someone drop me the definition. Textbook definition of med-surg, because now I'm super curious. What is the actual?
Did they actually tell you in class, the first day class? Welcome to med-surg class.
Med-surg
This is what med-surg is.
Here's what Webster's dictionary says. It's Webster's, right? What is that called?
Yeah.
Dictionary.com or whatever.
Coming to my finals week of med-surg, so you're over the hill or getting there. So
it can be easy. Yeah, see, we're gonna talk about that.
Awesome,
you guys. So med-surg is typically what you take in the middle of your program before you. Saying this more for you because they already know.
Okay. Yes. Again, they know I am not a nurse.
We have to catch him up, you guys.
Not in nursing school. I have not been in nursing school. I will not be in nursing school. I'm just here to join the fun.
You're not gonna go? You don't want to go to nursing school? You guys convinced him to go to nursing school. No, you would make a terrible nurse.
Med-surg is the hardest. All those systems.
Yeah, that's what you guys are all saying is the systems, cardiac, respiratory, it's all the things connecting everything together and learning all the stuff. It's really the part of nursing school where you you it's kind of like everyone's expecting things to come together, and instead of things coming together, you feel like your brain's just falling apart. That's
Huh.
probably a good way of putting it.
Is that a good way of putting it? Is that
yeah.
what you guys feel? Let us
Annie,
know.
is that how you're feeling? Shelly? Yeah.
Things
Coming
are
up
supposed to be
finally?
clicking, but things are not clicking.
Yeah, I think
Is that accurate?
you know, because like you have nursing instructors, right, that tell you, oh yeah, everything will make sense once you get to med surg, and then you get to med surg and you're like, nothing about the world makes sense anymore. I just don't get it. It's so true. Okay, everyone's saying yes on Instagram.
Okay, hold the phone.
I gotta tell you.
Hold the phone. Funny. Marissa, hi, start med surg next month. What do you recommend, Constant Maths? Christina, thank you for teaching me dose calc. I used to be horrible at math, but so far I've aced almost all of my math reviews.
Congratulations, Marissa. Nice.
Mm-hmm.
Love that. Yeah, I love it when you guys, well, I don't know. I feel good. Like, it makes me feel good when you guys tell me how our YouTube channel, how our Instagram page, how the membership community has helped you through nursing school. So I really appreciate that. Thank you. It keeps us going.
A constant drowning feeling.
A constant drowning feeling. That's a good way of putting med-surg. And unfortunately, like, med-surg just lasts forever. Okay, here's a question. How many terms of med-surg do you have? So we had 3, I think, if I remember right. 1, 2, and 3, like med-surg 1, 2, and 3 kind of thing. Yeah, I think that is what we had. If you connect it and be consistent, it can be easy. Nice. I wrote everything down that's connected and had a garbage bag of papers.
Question, how did you know it was a garbage bag full of papers?
Because
curious.
They probably threw it all away. How many like the stack, I've got to find the picture, like the stack of flashcards. Do you remember all the flashcards that we threw away after I finished nursing school?
You and your flashcards. So you do like your flashcards. Mm-hmm. Let me tell you.
I do. Mm-hmm. I do. 3 terms med-surg, 2 terms Alyssa. Okay, nice.
Third semester med-surg here.
Yeah, Hammer for Jost.
Yes. Awesome.
3rd semester med-surg. So there's 3, or maybe there's 4. Yes, glomerulonephritis. We just did a video about that. So, Annie, there's a video, right? It's up now. Yeah.
Yes, our YouTube video. Yes.
And YouTube.
It's. I was confused because it's been in the membership for forever. But
yeah.
Yes, we just did a video of it on YouTube. If you're interested, go and check it out on our YouTube channel. It was just a couple weeks ago.
Of course, if you want the full series on all the med-surg disorders that you're studying, they're all inside the membership community too. Mm-hmm. So if you guys are a member, just remember you have access to all of that stuff. All the med-surg disorders, where literally we break it all down for you step by step. It's all inside the membership community. Beginning, intermediate, 2 terms of advanced. So you have 4 terms of med-surg.
So for those of you guys just joining, welcome to the Nursing School Show. We are currently discussing the hardest thing about med-surg. Actually, we're just asking people what they think the hardest thing is, and then we'll dive into it. And then I think we're also trying to figure out how many terms of med-surg people are having. So
yeah, I'm just curious.
It does vary, it looks like. So
yeah, I'm just curious. So okay.
All right.
So I feel like I should have thought more about this before I came on live, but I'm just gonna kind of like jam on med-surg for a little bit.
Yeah, well, so let's back up. So correct me if I'm wrong, guys. All right, so just looking through all the comments that we've been getting and our talks, and also what people have said to us in the past, really what people are struggling with med-surg, the amount of information, all of the different systems, this constant drowning feeling, just overload of information, and all this coming at you, and the
connecting everything
together. Just I guess that's really it. The amount of information and confusing some of the disease processes and things like that. So it's amount of information, how to digest it, and how to remember it all. Is that roughly it? Is that am I getting that correct? Is there anything else out there that I'm missing?
I was going to mention, I think a really big part of med surge is the kind of, well, like what you guys said. Sometimes the questions, okay, like the questions that they ask right on the exams can be kind of tricky. I think really where the issue comes in with med surge is that there is so much information so fast. Like you have an exam like every single week, right? And maybe a couple exams every single week, depending on how many classes you're taking. Then you also, med surge typically is the time in nursing school where, oh, can you hear the baby? Um, Typically, med-surg is the time in nursing school where your clinical days actually increase. So not only do you have more information that you're learning about in class, but now you have, instead of maybe one clinical day, if you had one clinical day in fundamentals, now you have two, maybe even three if you're in advanced med-surg. You're also probably taking more patients at clinical. So clinicals are more intense, they're more exhausting. There's just a lot going on. You have all the information you're learning in class, and now you have to apply it at clinical in a more up-leveled way. That's a loss of words there, but like a more robust way. So I think just kind of those things, and then also balancing life in the midst of all of it. It can be really hard. Annie is so much at once. Yeah, seriously, so much at once. Literally have to study hours a day to retain it all. Yes.
Okay, so
Increased,
the
yes.
time commitment has increased during med-surg.
Massively increased. And I think maybe just brain power. Maybe that's where a lot of the exhaustion comes in, is like the brain power. Marfa just correct, okay? Yeah, so you guys all seem to agree with Matthew's overview, so that's nice. Hi, Daisy. Hi, Stephanie. Hi, Emily. Nice to see you again. I find the pathophysiology of a disease super interesting, so I'm hoping that it will keep me motivated in med-surg. Nice. That is actually something that I did want to talk about on the live, is just knowing, like Matthew said yesterday, know yourself. And don't listen to the rumor mill in nursing school, because so many students will say that, well, actually, yeah, on Instagram you were saying, or sorry, YouTube, Michael, you were saying that you have friends in med-surg, many tears, and many are failing. Is it truly the hardest class in the program? So that was your question. That is the rumor. Like, that is what people say, right? Med-surg is going to be the hardest part of nursing school. But here's what I want to offer you today. I want you to consider this, okay? That your strength might be someone else's weakness. So, let's go back. Emily, you said that pathophysiology of diseases you find super interesting. You're hoping that it'll keep you motivated. I saw some other comments on Instagram as well. I'm not going to scroll up though, because Instagram gets a little glitchy. But the point is that your strength might be someone else's weakness. So where other students might find med-surg to be really challenging and almost like too overwhelming and impossible, you might be totally fine. And so was my experience, because like my best friend in nursing school, she was a rock star at clinical. And I was not so good at clinical, like skills. I was not good at skills. But the med-surg stuff, like the lecture content, man, did I just fly with that. I really, really, I'm with you, Emily. Like, I love pathophysiology. I love how, learning about all the disease processes and everything, all that. I love it.
Yeah, so I think that's a really good point. Be really careful about the rumor mill. Be really careful about what you hear, even if it's true or not. Michael, a lot of people that you know are in tears, a lot of people failing. Whether that's true or not, it does affect you when you go to that class.
Yes, for sure.
So if you already go into it with this preconceived notion that it's going to be hard, you're going to prove yourself right. So it's important to take everything we hear with a grain of salt and see what is useful, what is helpful, and just let the other things go and don't let those affect you, because you don't want to be handicapping yourself when you first get into med surge,
Right.
with
For
all
sure.
these conceived notions that, oh, everything's hard already, so no matter what I'm going to hear, it's going to be hard. Well, that's not a very helpful way of looking at things either. So just be open minded, and again, see what your strengths are and lean into your strengths and find the benefit and positive things, because that will help you out a lot better than just focusing on all the negatives and all the negative things that people say about it.
Yeah, absolutely. I think just, yeah, keeping that in mind for sure, and making sure that you're putting things really in perspective. Like we kind of talked about it last night a little bit, like stress. Like how do we what's the word, get through, or like man, how do we manage stress, right? So med surge definitely going to be more of a challenge, like we've been saying. It's just a lot more information all at once. There's a lot of things that are thrown at you all at once, and a lot of things, more things going on, that you'll just have to keep track of. And so you really have to make sure that you are really managing your brain really, really well, because it's going to be tougher, and you're going to have to kind of pump yourself up.
Yeah.
I guess sometimes is probably a good way to put it.
Yeah, if you want to hear more about motivation and stress, we did discuss that on our live yesterday. If you guys were with us, then you've heard. If not,
so crucial.
After this live, definitely go back. All our lives are on our YouTube channel, so definitely go back and take a look at that, because that will really help you with motivation, with stress, on dealing with it in med surge, because that's something that you guys go through.
Arbriel, like a lot of you guys are saying that you like med surge. See, yeah, I mean, I think it can go both ways for sure. So like I said, don't listen to the rumor mill. Your strength might be someone else's weakness. Someone else's weakness might be your strength. So don't get too worried about it. As far as like learning things, in a like putting things together and connecting the dots, like what have you guys found to be like the most helpful for you to connect things together and study in med surge? I'd love to hear your thoughts on that. What are like the things that have been so helpful for you, with connecting things together in med surge? I'm curious. Deborah on YouTube, don't give up, please. Even if you don't, actually, we have a whole YouTube video actually on what to do if you fail an exam. So if you guys have had the experience of not doing as well on an exam as you wanted to, definitely go check that out on your YouTube channel. So youtube.com/nursingsos, and we have a whole YouTube video on that. So that's for you, Deborah.
Michael, just have to go in with a positive mindset for sure. Just got to study my bottom off to pass it. Yes.
Recorded lectures, Stacy. I love. Okay, for you guys who can record lectures, that is huge. It's a huge deal in nursing school. Please, please, please record lectures, because it will be so helpful for you. Concept maps are real. Yes. Yep. Signs and symptoms, patient teaching, patho. Yep. All of that.
Shelly, it's a really interesting course. The tests are tough because you have numerous answers that are right, but you have to choose which one is the most right, the best answer.
The best
answer. Yeah, for sure.
Yep. It's that. What is it? There's like there's a meme that's, I think it's the word potassium. Is it the word potassium? Where it's like, which letter is right or whatever, and it's the S. Like there's two S's in the answer. It's like, it was actually the first S, but you selected the second S in the word, and that is not the most correct answer. Like, have you guys seen that meme? It's terrible. But
what's the most correct?
What's the most correct? Yeah. It's very tough. So you guys know that we always want to focus on in med surge the four main things: pathophysiology, signs and symptoms, nursing assessment, and nursing interventions.
So I'll just cut in here just real quick. So yes, this goes towards what a lot of people have been saying is really what's the hardest thing about med-surg, and it's the amount of information and how to study and how to remember things. And so how we go through it in our membership or any of our numerous YouTube videos, med-surg, it's really, those are the four most important aspects of med-surg that you need to focus on. And having this focus will help you guys out a lot in med-surg. So what are the four things?
Patho, signs and symptoms, nursing assessment, and nursing interventions. Yep. So, as you're studying, you really want to focus on those things. I think it was Arbriel, you mentioned that you learn diagnostic tests too. So you can, that can fall under the interventions category. The thing is that oftentimes you're not really tested on diagnostic tests. Like, you're often not tested on, like, you're not going to be tested on things that the doctor's going to do or stuff like that's going to be ordered for the patient. You'll be tested on the nursing aspects of that, let's say, so for example, like if you get tested on like there's a chest x-ray question, like you're not going to be tested on like how to interpret that chest x-ray, obviously, but preparing the patient for a chest x-ray, that's something you might be tested on, which would be under that nursing interventions category. So there's a lot of information in your med-surg books that is not going to be helpful for you when you take your exam. So you really, really do. That's why we always say focus on those four things: patho, signs and symptoms, nursing assessment, and nursing interventions. That is full stop. That's where it that's where it ends. And just focusing on those are going to be really, really helpful for you. Are real true. Yes. Yes. You said Shelly. Yeah, with the whole even SATA questions, obviously. How many of you guys love SATA questions? The select all that apply question. Said nobody ever. Sorry.
And so with those four main things, obviously everything starts with patho. So what you're saying, that you like pathophysiology, or a lot of people actually do like med-surg, and how the human body works is amazing. And yes, I agree. So definitely start out with the patho, and then off of that you can do the signs and symptoms, nursing assessment, nursing interventions.
Yep, exactly.
So a lot of times, like, if you don't have a structure, if you don't have a game plan, if you don't have a method to the madness,
to the madness, good way of putting it.
When you just get dumped on all this information, here's all this med-surg stuff, and you don't have a game plan on how to study it or how to digest it, then obviously it's going to feel very overwhelming, which is what we've been seeing a lot with the hardest thing about med-surg is really just all this information. But now you have a game plan, you have a structure to put everything you're learning into. So patho, signs and symptoms, nurse assessment, nursing interventions.
Oh, Wilbert on YouTube. That's funny. I mean, there's just so many disorders to know. There really are. So it can be, like Matthew said, I mean, you have to have a system. Like, you have to have a process, which is exactly why we teach it that way. Patho, signs and symptoms, assessment, interventions. Keep it clean, keep it simple. That is what you need to focus on. If you focus on those four things, you will do great. I think, like I said, kind of as far as med-surg, connecting the dots. Someone said concept maps on Instagram. Do you guys use concept maps? A lot of you, like, who uses concept maps? Send up an emoji.
Oh,
Send
yeah,
up an
and
emoji.
let's see. I am going to scroll up because I think someone mentioned it also. Yeah.
Can we do
maps,
a poll? Let's do a poll on YouTube.
All right, I'm going to do it.
Because I like
Create
polls.
a poll. So what's the question?
Do you use concept maps?
Do you use concept maps?
Arbriel, was it you that said concept maps? I don't remember.
Ask your community, and please respond to the poll, because I like doing these things, and I want to I want to
We
prove
like
to myself
polls.
that it works.
We like polls on YouTube.
Yes.
Pretty fun. I do polls on Instagram all the time on my stories. I really like them. Yeah, concept maps. Good. So because concept maps are really helpful just because like writing everything out, and in a visual way where you can connect it, right? The patho, the signs and symptoms assessment, interventions, all you just like you can see it really visually, and then you can connect it to other disorders as well. So I think they can be really helpful if you're a visual learner, or even like kind of what we say is a kinesthetic learner too. If you learn by like doing an activity, then really just the act of writing things out in nursing school can really help.
Mm-hmm.
Just like you're writing it out, you're writing out the words, you are studying as you're writing out those concept maps, writing out flashcards, things like that. And that so you see it visually because you're writing it out, you're getting the kinesthetic motion because you are actually writing them out. So it can be really helpful. So on YouTube, you guys say, "See, I wish I could do polls. I can't. Can I do polls?"
I don't know. On YouTube, you guys, the yeses, you guys need to catch up because you guys are falling behind.
Oh yeah, so 69%.
So it looks like on YouTube, most of you guys do not use concept maps. That could be something to try out. Again, really using them and visually seeing how concepts connect to each other really can help with your topics for sure.
We're still live, right? I'm not messing anything up. I don't want to. No, I don't want to.
Christina's.
See, Instagram, I can't poll on. Okay, let me try this button. Nope,
that doesn't work.
That didn't work.
And if you guys don't use concept maps, what are your pointers or what are your best techniques for studying med-surg that you have found? Because I'm sure everyone else would like to hear.
Oh, good. Thanks, Emily. We're still live. I didn't mess anything up, did I? I can do like filters and stuff. That's kind of fun. I didn't put a filter on. I wish I could do polls on Instagram Live. That seems like a feature that really should be there. Gabby, yes, the questions give me anxiety. Like questions, the SATA ones, and the select the most correct
the
answer.
Most correct. Hey,
yeah,
yes.
I think that med-surg is really the first time in nursing school where it's like, what's that phrase? Rubber meets the road, and you start really getting the select all apply questions. You really start getting the what do we want to call those ones? Just the select the most correct out of all the correct answers. Mm-hmm. Select the most correct one. It's really the point in nursing school where you start getting more of those. And they just get harder, like increasingly harder, because like fundamentals is tricky, but they're not like med-surg hard. They don't take because you don't know as much information too. So in med-surg, you have to now build off of what you learned in fundamentals, right? So now you're basically tested on everything. You're tested on what you knew and learned in fundamentals and how you apply that to now med-surg and what you're learning about in med-surg. So it all comes full circle.
It's those cumulative exams.
That's exactly what it is. It's like basically taking a final every single exam because you're through nursing school, you're tested on all the old stuff too, because you really have to bring it all together.
Mm-hmm.
Yep.
So how do you do a concept map? How do you do concept maps?
You know what? Actually, we have a whole video. Really? This was our first YouTube video ever.
Oh.
It was literally the first YouTube video I ever uploaded. And it still gets a lot of views from what I remember. I think it's like one of the most popular concept map videos, which is so funny. This was like back in 2017 or something.
Go check it out. Check it out, and on our next live, comment back and see. Let us know how it is.
Let us know how it is.
Yeah.
The audio is probably terrible, but and it's just a PowerPoint. I think it's just a PowerPoint, and I show you how to make concept maps. So yeah, seriously, you guys, go to our channel, go to YouTube and type in concept map. I'm pretty sure it's still there. It was just like, it was basically even before we started our channel or any of this. It was just a video that I did for a blog post, and I just uploaded it to YouTube. And people like it, apparently. So I thought it was helpful. So yeah, go back and check that out.
Definitely
Annie.
go back and check it out and let us know, because I don't remember that, and I'm curious because I am the one that does all the editing. I'm not even sure if I did the editing for that one.
Oh no, you did not. No, it was just me. It was PowerPoint slides.
Oh, okay.
It was way before. It was way before any of this. Yeah, long before.
Those are the best. Those are the best. Go back and check it out.
Like,
and while you're at it, subscribe and hit the bell.
Yeah, subscribe to our YouTube channel. Hey, I think we're almost at like 96,000 subscribers. You guys are like, this is insane to me. Crazy.
All right, I'm gonna end the poll because it's on 50-50.
Yes,
so,
keep it at 50-50.
All right.
We're not biased at all. That's funny.
Tyson. Yeah. Oh, thank you so much. Oh.
Nice.
Awesome. Silly question from... Do you want to challenge that? So, silly question from someone that doesn't use... do you isolate each disease and then just include signs, symptoms, nursing interventions, etc.? So this is going back to, again, the structure to study any disease, disorder, etc. in med-surg. You want to
Shelly knows us so well.
Patho, signs and symptoms, nursing assessment, nursing interventions.
Yeah, those are just the 4 things you're going to want to focus on. Now, Shelly, when you make concept maps, you can do it for anything that you want. Anything at all. You can make a concept map on anything. So, you know, if you... I don't know. I typically do it for med-surg and those disorders like that, and then I like to connect them together. So what you can do, this is what I did, was you can even put like in the middle bubble, put like diabetes and hypertension, and then in the like you can put in one bubble like compare like similarities, and then another bubble do like differences and like, you know, things. So how are they the same, how are they different, what things are similar with them. So you just get creative, you know. I don't think there's really a wrong way to do it.
I don't think so. It's just a way of visually seeing connections between ideas.
Yeah.
It's a map of concepts.
I see what you did there. That's funny. This is a dad joke.
I'm getting there.
I'm learning.
I'm working on it. Yeah, so just it's maybe a way of uncovering different connections that you normally wouldn't have uncovered. So yeah, just try different things out, different lines and different ways that different ideas connect, and just see what pops out in any bubbles and see what happens.
It's a good visual. It's a good way to visually see it. So, Shelly, yeah, go back to that video, okay? On YouTube. You guys, like, seriously go watch that video. We should go check that out after this live.
Yeah.
Because I want to see how the audio is, and I want to see how many views it has, because I still check it out. Like, I think it still gets views. So funny. It's so old. But it's great. It's a good one. And I have examples there, too. I have concept map examples in that video. So... it's actually a really good video. It's a really good video. We should maybe redo that one on concept maps. But yeah, I think that there's a lot of things that, a lot of reasons why people consider med-surg to be more difficult. And so those are most of them, I think. Like what you guys were saying, and then also... you know, there's some things that we threw in, but those are really, I think, what Matthew was saying about keeping things consistent and, you know, our strategies for studying med-surg that we always teach: patho, signs and symptoms, nursing assessment, and nursing interventions. And make sure that you're connecting things together. So, like I said, actually, I know a lot of you guys on here are Nursing Assos members, so make sure that you go into the Nursing Assos membership community, log into your dashboard, check out the Nursing School Study System. So it's just, you know, up there. You've seen it. You know, log into your dashboard, click on Study System, and then download it if you haven't yet, or just scroll down, find the page, because in there I walk you through literally step by step how to study Med-Surg in nursing school. So that's inside the membership community for you. So check it out.
Yeah, for sure.
Nursing school studies. Well, cool, friends. We have kind of a fuzzy baby, so I don't think he's gonna go back to sleep. So, we will be back tomorrow. Hey, can you post in the chat real quick what topic you want for tomorrow? We're kind of thinking through. Yeah. Hi. Do you have thoughts about a topic for tomorrow?
We're
Baby has thoughts about a topic for tomorrow.
Figuring out a schedule and topics, list of things to go through for our lives. We do want these lives to be helpful for you guys, so definitely shoot in the comments what would be helpful for you. And we want to keep it high level and help as many people as possible at once. So we're not going to be diving too much into specifics necessarily, because we're not sure how many people will find that helpful. So instead, we're doing these kind of high level topics. So hit us up with any topics that you guys want to talk about on this live, and we will add them to the list to figure it out.
Daisy, hematological disorders and cardiac disorders, we have all of them inside the Nursing SOS membership community. And then we have, well, I actually just posted an Instagram post on left-sided heart failure. That was fun yesterday.
Yeah.
The one yesterday. But yes, so inside the membership, and I'm trying to think on YouTube, we might have something on.
Definitely check out our check out our YouTube channel.
Get on the wait list for the VIP list. Get on the VIP list for the membership community for when it opens again. Actually, someone just asked, do you allow enrollment into the community throughout the year? No, we don't, Emily. So our Nursing SOS membership community is closed for enrollment for the vast majority of the year. We actually open it up maybe a handful of weeks through the year, only for 1 week at a time. So it will open again in the spring. So actually stay tuned, because it's actually not too far out now.
Too far out.
So get on the VIP list, because it'll actually be opening pretty soon. So definitely get on that.
Brenda, for OB, all of our OB videos are in the membership. Peds for Nia, how to study peds.
Oh, that's the same thing. Yes. Yeah. So Med-Surg, patho, signs and symptoms, nursing assessment, and nursing interventions for pediatrics. The disorders really, the great thing about peds is that the disorders are very similar to Med-Surg. So, like, you still have asthma, you still have, kids don't have, like, cardiac issues unless they're the congenital issues most often. But, diabetic ketoacidosis, diabetes, type 1 diabetes, asthma for sure, but I don't know, some things are more adult, like chronic bronchitis is more of an adult thing, right? So there will be differences, but it's nice that pediatrics, a lot of it is very similar to Med-Surg, so we study it the same way. Patho, signs and symptoms, nursing assessment, and nursing intervention. So Nia, you're gonna rock it. And yes, we have a full OB course inside the membership community for you.
So if you're not
Brenda,
go ahead and pop over to nursingSchoolofSuccess.com/join to join the VIP
list.
We just rebranded it. The VIP list.
We used to call it a wait list, but it's not really a wait list, because it's just like, hey, get on this list, and then I email you right when enrollment opens, so you're the first to know. So it's not really a wait list. So we're rebranding it to VIP list, because I don't know, that sounds better.
Because everyone's a very important person.
Yes, of course. Yep. Alrighty, friends. We will chat tomorrow.
Yes, we'll chat again.
I'll do an Instagram story, and we'll figure out what topics we want for this week and next week. Because I think that will be good.
All right.
We want to be as helpful as possible.
For sure. And if you guys have any more ideas on topics that we can talk about on live, or if you guys just want to chat, just kind of do a chill, grab a cup of coffee and just chill out with us and just talk about things. Let us know if that would be helpful.
Read Emily's comment on Instagram. I never knew that's what SOS stood for. I don't know if anyone has ever said that to me, Emily, actually, because when I started Nursing SOS, it was called Nursing School of Success. That's where our blog is, nursingschoolofsuccess.com. And then Matthew and I were talking, I was like, that is way too long. So this was like a year into the blog, and I'm like, this is way too long to say all the time. Nursing School of Success. So I was like, Nursing SOS. Nursing SOS. That makes sense because it's like SOS. You get it? Okay, it's funny. But yes, it stands for nursing. Yes, exactly. I thought it was nursing send help. Right? But it makes sense. So Nursing School of Success. I don't think anyone has ever asked me that before, Emily, or like got it. I don't know. Maybe other people get it, but nobody's told me that they get it. So thank you. That made me so happy. I remember that day. Genuinely, I was like, Nursing SOS! That makes total sense. Okay. Yes, nursingschoolofsuccess.com/join. I would love to help you more through nursing school. Inside our membership community, you are going to love it because it is so fantastic. All right, friends, we will see you tomorrow, right?
Yes, tomorrow, same time, same place.
Same place.
We'll catch you on the flip side.
On the flip side. Okay. See you later.
Take care, everyone.
Bye-bye.
Bye.
Bye-bye. That's funny. On the flip side. Share.